the producer and host of The Lynn Hayes Freeland Show, a weekly half-hour show that concentrates on African American issues. She began her broadcast career at KDKA Radio. In 1976, Lynn joined the KDKA team and has held a variety of positions, including creating Weekend Magazine, producing what was then known as Vibrations, and directed a variety of commercial efforts. In 1985, Lynn began a 5-year stint as the producer of KDKA's annual Children's Hospital Free Care Fund telethon. As a result of those efforts, she was named Director of Community Programs until eventually making a move to the news department. Lynn has also been involved in a variety of community service work, including volunteering time on several local boards. Her work has been recognized by organizations both locally and nationally. She is a graduate of St. Paul's Cathedral, now part of Oakland Catholic, and Duquesne University. Please join me in welcoming Lynn Hayes Freeland.
Thank you so much for that, Bobby. It is such a historic day. I am thrilled to be a part of this inaugural program. Now, today's session, the question before us is focused on the challenges of childcare and women needing to leave the workforce during COVID-19. Now, in early fall, the United Way launched the monthly Pulse Report with a variety of partners, which shares important data and insights about the issues impacting our community. Now, this report highlighted the impact COVID has had on women and childcare, and here are just a few of the things that have been identified. The pandemic has highlighted two pressing issues that affect women and are closely related: childcare and employment. Nationally, the share of women currently in the labor force is the lowest it has been in 35 years. 55% of women are making career or workplace changes so that they can afford or provide childcare. At the same time, we've seen a larger increase in unemployment, not currently working, but actively looking for work, for Black and Latina women compared to white women. The pattern of women leaving the workforce aligns with the gender and racial makeup of service industry, healthcare industry, and education are women. Approximately 1/3 of employed Latina women and more than 1/4 of employed Black women are in service occupations, including personal care aides, home health aides, nursing assistants, cooks, and food service staff. With children now at home due to remote and hybrid schooling and reduced capacity in child care centers, the pandemic has removed some of the supports that have made it possible for mothers to work outside of the home. Affordable quality childcare was hard to come by even before the pandemic. But COVID has forced providers to decrease their capacity due to health and safety concerns, creating additional gaps in available childcare seats. The loss of childcare spots has repercussions at all levels. Women providing childcare are out of work. Parents needing childcare have lost access to care and, in many cases, had to leave the workforce. We need to start having conversations and thinking about the repercussions of mass exodus of women from the workforce. Today, we are joined by an esteemed panel of women who will share their perspectives with us today. Now, there's another important voice we want to hear from today, and that's you. I really want to encourage you to use the comment box to ask questions of our panel, and we'll get to as many of your questions as we can during the Q&A session a little bit later. Now, first, I'd like to welcome Diane Holder, United Way board member and president and CEO of UPMC Health Plan. Diane brings over 30 years of healthcare and health insurance expertise to her role leading the health insurance enterprise of UPMC. UPMC includes 40 hospitals, more than 5,000 employed physicians, extensive community based services, international programs, a commercialization division, and a large portfolio of health insurance companies. As president and CEO of UPMC's health plan, president, insurance services, and executive vice president, UPMC, Ms. Holder provides the strategic leadership and operational division for a family of 15 health insurance and benefits management companies, offering coverage and benefits management to over 3.9 million members. Now, Ms. Holder received her undergraduate degree from the University of Michigan and her graduate degree from Columbia University. She serves as a faculty member of the University of Pittsburgh School of Medicine, their Department of Psychiatry, and as an adjunct faculty member of the University of Pittsburgh's Graduate School of Public Health. Ms. Holder serves on numerous boards, including the Alliance of Community Health Plans, the Insurance Federation of Pennsylvania. Sorry, sometimes I have so much to read and I try to wear my contacts and not always my glasses. The Evolent Health, the Senator John Hines History Center, and the University of Pittsburgh and United Way of Southwestern Pennsylvania. Now, she was recently named as one of the top 100 leaders in healthcare by Modern Healthcare and was designated by Governor Tom Wolf as a distinguished daughter of Pennsylvania. Now, she's a frequent speaker on the subject of healthcare, quality, financing, and the role of the community in addressing disparity in health outcomes. And as the founding CEO of the Community Care Behavioral Health, she's had a special interest in health policy for women and families with mental health needs. Next, we're pleased to present to you Cara Simonello. Cara is the executive director at Trying Together, formerly the Pittsburgh Association for the Education of Young Children, the voice of early childhood in Southwest Pennsylvania. She is a passionate advocate for young children and the predominantly female workforce who cares for and educates them. Cara works to ensure childcare providers are their best for our youngest by working to ensure that the policies and systems they operate within support their ability to focus on what matters to children's optimal development, meaning relationships, discovery, and play. Cara has a particular interest in coalition building around a common goal, as exemplified in her international role working with teenagers and the establishment of the Playful Pittsburgh Collaborative. She seeks to bring that to her work on behalf of young children as well as their caregivers. Cara has her undergraduate degree in ethnic studies from Bowling Green State University and her graduate degree in administrative and policy studies from the University of Pittsburgh. Cara is currently quarantining in Highland Park with her husband, her two daughters, and her two dogs. Finally, we are joined today by Dr. Angela Reynolds. Dr. Reynolds serves as the CEO of the YWCA of Greater Pittsburgh and is committed to racial justice and gender equity with a strong commitment to eliminating racism, empowering women, and promoting peace and justice in our region. Now, prior to her current position, Dr. Reynolds was an assistant professor at the Graduate School of Public and International Affairs for 12 years at the University of Pittsburgh, where she taught statistics and performed research on affordable and fair housing. In 2012, she joined the United Way of Southwestern Pennsylvania, where she served as the senior director of United for Families and 211. Now, under her leadership, 211 expanded to over 30 counties in Pennsylvania and provided coverage for Southern Kentucky. She served on the state PA 211 board and 211 National Steering Committee. Now, Angela is the mother of four and an associate pastor of her church, and she resides in Pittsburgh with her husband, her youngest child, and her mother. Dr. Reynolds was also the 2020 Athena Award recipient, the Pittsburgh Smart 50 class of 2020, and she has received awards for her community and housing work, including a proclamation from the City of Pittsburgh City Council declaring Thursday, October 22nd, 2020, Dr. Angela Reynolds Day. She holds a PhD in public policy analysis from the Heinz School at Carnegie Mellon University, an MS in statistics also from CMU, and a BA in mathematics, sociology minor from Bryn Mawr College. We are very fortunate to have such a thoughtful, influential panel of women leaders today. So let's get started with the question before us. Has COVID-19 created a childcare crisis? Let's go first. We'll begin with Angela and Kara. Let's look at the infrastructure of childcare. It's been deeply impacted by the pandemic. From your perspectives, have primary caregivers been impacted the most? How have they been impacted? And how do you think the system will be able to move forward?
Thanks, Angelo. This is where we're trying to figure out who should go first.
Who should go first? I'm sorry. So, Kara, you'll start.
That's okay. That's okay, Lynn. Thank you. So yeah, I mean, I will say it's been an interesting ride since March. And Angela can attest to this. The Y has a childcare facility, and so I'll let her speak to her personal experience at her organization. But I think what's interesting to note about childcare providers themselves in the sector is it's about 95% women-led and owned small businesses. So here in Allegheny County, we have something like 650 licensed childcare programs, which provides employment for around 7,000 childcare providers or childcare workers. Again, nearly 100% are women. Prior to the pandemic, the way in which childcare is financed through both public and private dollars, they were already sort of operating on a razor thin margin. And again, this is something Angela can speak to. And in part, it's because of the way that our public system reimburses. And then also in part because we know that families aren't, at the time that they're childbearing, they're not in their peak income revenue generating phase of their life, right? And so there's a real limit to what families can afford. Now with COVID, all the increased costs related to mitigating COVID, to creating more of that distance. Lynn, you talked about it in some of your opening remarks, creating that distance between children, and decreased enrollment because more families are at home, or because families have immune compromised family members, and so they're not comfortable with sending their children. We have decreased enrollment in many of these businesses or these programs. All of that has had a really challenging effect on the sector itself. And the needs have been great. And so I'll pause for a second. And Angela, if you wanna step in, and I'm happy to piggyback and talk more a little bit later.
Great, thank you, Kara. And as you probably have gathered, I believe all of us could talk about this topic until probably next week, right? And so I wanna go back to the question before us and what was posed. Has COVID created a crisis? There was already a childcare crisis. And so let's just keep that in mind. So then you bring a pandemic on top of it, and then things are exacerbated. So in terms of the specific question that you asked, who are the caregivers? From our perspective as YWCA, I see two, right? So I see the caregivers who are the parents who are entrusting their children to our care. And then I also see the caregivers who are my team and my staff who are caring for children for our working families. So I want to go to the second one, and then I'll go back to the first. So when we talk about those caregivers, and as Kara already mentioned, we're talking predominantly female, like over 95% nationally, and then Kara gave you statistics here, but then also we're talking predominantly women of color. And let's also bear in mind that childcare, in order to keep costs low, we also have to look at the pay scales for childcare workers. And it's a challenge. And these are caring individuals. I still have an image in my mind over the summer as we were doing a food distribution for some of our families who, after the governor shut us down, like our teachers had not seen their children in months. And the looks on their faces just to see the children driving through a parking lot to have food put into a trunk, they miss their children. So we're talking about people who genuinely care. They want to deliver quality care. They want to deliver affordable care. And then we need to make sure that policies are enabling us to do that. So we'll talk about them some more later. But now let's look at caregivers in terms of those who are dropping their children off. Demographics vary. Our center is located in Homewood Rushton, so we are predominantly African American, and our center is also predominantly low income. But also bear in mind that it's not a monolith, right? So we have some that are, two-parent families. We have some that are single families. We have some where the father is the primary caregiver. We have also families where grandparents are the ones who are caring for their grandchildren. So we have this mixture, but we have seen that we are predominantly female-headed households who we did a survey, and on our survey, for those who responded, 100% on our survey had lost income. So you can look at all the wonderful national studies all you want to that talk about 60%. 100% of our families had lost income either due to losing their jobs or having reduced hours. So that challenge, again, that's brought on by the pandemic then just exacerbates all of the issues that are before us. And again, we could talk about this for days, but we don't have days to do it.
Sorry, there's always going to be that little delay when I unmute my mic. So I'll try to be quick with that. All right. This is going to be a question for all of our panelists. And Diane, we're going to start with you. Can I get you to speak specifically to some of the ways that you've been able to advocate for change or supported women during this time, and talk about what some of the biggest or the greatest needs have been?
Sure. So one of the things I think that all of us have seen in this pandemic crisis is that a lot of the problems that were here before just became so obvious and magnified. So whether you're talking about who got sicker, who was more likely to get infected, we know that it was more our essential workers, it was our frontline people, it were more people of color were impacted in terms of morbidity and mortality. And we also know that different kinds of businesses and different kinds of families were differentially impacted. And so one of the things that we tried to do, and I'm going to speak from my role first, running health plans. There's lots of different kinds of people, lots of different kinds of needs. Well over half of the people that we cover for health insurance coverage are women. Many of them have children. And one of the first things that it was pretty clear is that if I look at the small business community, our health plan in this region covers the majority of small businesses. And we all know that women-led, women-owned businesses have been a rising percentage of businesses. In fact, our national economy, if you look at the last decade, has been heavily driven by the number of women who've started businesses. But the businesses they started were more likely to be the ones that would be impacted by COVID. So when you think about foot traffic businesses, they call them, right? So retail, service industry, hair, nails, small shop retail, food, a lot of the things that women, childcare, a lot of the businesses that they started were more likely to be impacted. Secondly, they are companies that were younger, often newer, didn't have the investment potential, didn't have the ability to go out and get the same loans. So what we started to do was to look at how do you support families, because income becomes an incredibly important base. And so we began to work with Huntington Bank. We put on seminars for companies on how to get the PPE money and loans. We basically put grace periods in so people didn't have to pay their health insurance premiums at the same rate if they needed some time, additional time. We also did things like outreach and seminars, and we were able to, I think, begin to impact people a little differently. We have something called Life Solutions, and Life Solutions is a program, and we've had 75,000 interactions, calls, support counseling calls in our Life Solutions program for the last, just since the pandemic began. And part of what people are calling about are, how do I get food? How do I get transportation? Who can take care of my child? I can't come to work. So it was immediately important for us to understand that companies needed the kind of flexibility. We were fortunate on the insurance side. We can move our employees to virtual, overnight. We had that ability on the payer side. Our nurses couldn't stay home. They had to come to work every day. Lots of our service workers had to come to work every day. But we tried to put in as much flexibility as we could, and we tried to counsel other employers in the region on how to put flexibility in for themselves. So at the individual level, we tried to work with people, but we also cover a lot of people who are on Medicaid. And so one of the things that we did is we worked at the policy level. There's a bill out there sponsored by Representative Kelly in Illinois. And this bill is called the Helping Moms Act. And we advocated for that because part of what happens in our country, unfortunately, is oftentimes women, after they give birth relatively soon, they lose their health insurance coverage and Medicaid. We had to help advocate, and we believe at the policy level, individual level, we need to provide advocacy. So I'm going to just stop there because I know that there are so many things that the pandemic has impacted. But I think one of the most important things is how do we put some supports and services around people? How do we connect with the 211 number? How do we begin to help people as a community? And how do we come together to look at I think it's really the infrastructure that gave way. If you don't repair a bridge, don't be surprised when it falls down in a crisis. So I think part of what we've had is our bridge was not built properly. And I think as we look forward coming out of this pandemic, hopefully, we should be learning lessons from this and being able to put some different structures in place.
Angela, I saw you nodding. Do you want to add? Do you want to jump in there?
Yes, and I won't be able to talk about everything, but I'll try to do it at a pretty much high level. And so I actually first want to start with a thank you. And that thank you is to our funders who helped us to fill in the gaps as we were trying to look at some changes at a higher level. So advocacy and systems change is not always legislative. And so there are some things that you can do on a small scale while you're still fighting for getting those larger scale changes. One of the first things that we did was we looked again at our families and said, how do we make it easier for them to access services? And so one way that we were supporting women was like looking at expanding the work of YWCA and making it easier for people to connect to support for basic needs. Again, people lose income. You lose income, you lose your ability to pay your rent. You want to make sure that someone's not facing an eviction. So going down that road. The other place is also bearing in mind that our workers, many of them are also parents. And so how do they deal with the fact that they don't have childcare and you have a school that is now virtual? And so being able to provide some flexibility for our parents who are working in the childcare center and some being able to take leave for a period of time in order to care for their children. So those are just a couple of examples. And then also, thanks again to one of our funders, we were able to offer scholarships to some of our parents in order for them to keep their children in. And then we have Kara on the call, so Trying Together has been a tremendous support during this time, and I'll let her speak more to that. But even being able to say, while our center is with those who are 0 through 5, once virtual school happened, being able to work with our partners to open up one of the community hubs. And again, United Way and Trying Together were very instrumental in that so that we could then serve K through 5 children. And then bringing that up a little bit higher is then saying our childcare workers, I'm going to say it loud and proud, they are essential workers. They are going to work now every day once childcare centers reopen, and they are also putting their lives and their health on the line. And so advocating for hazard pay, being able to even long-term advocate for higher wages, making sure that we're taking care of our employees as well. And I've even, sent letters to legislators saying, I believe that our childcare workers should be in tier 1. So we'll see how the vaccinations roll out, but being able to take that up to a higher level. We've also worked as state associations of YWCAs, and we partnered with YWCA USA for some of their national initiatives. And so I'm hoping that someone from United Way could put this into the chat. But if you haven't seen the YWCA USA report with LBJ School, it's really, it's a critical report. It's America's recovery from the 2020 SHE session. And there are several legislative priorities in there that will be pursued and that we're also coming alongside of.
Thanks, Angela. And I'll just jump in if that's okay, Lynn, and just add a little bit more. You know, very similarly to what Diane was sharing and Angela was providing evidence of, I think we've really tried to respond in three big ways. First and foremost, it's about advocating, or it was about advocating at the federal, state, and local levels to make sure that childcare was included in the COVID relief plans. You know, that was something, going back to Diane's point around infrastructure. I think one of the things that we have all learned is that there's a real caregiving infrastructure problem. You know, we've got roads and bridges and utility companies and all these other types of hardscape infrastructures, but what we don't have for families is caregiving infrastructures. And I think that really came to surface and be highlighted through the pandemic. So really advocating to make sure that childcare was included in all of that relief funding so that we can keep our doors open. And then second, I think it's been, and we've got a recent challenge that we're actually looking at right now, assessing the pandemic policies that the state and federal agencies are putting forward that are affecting childcare providers. So right now, you know, we've talked about decreased enrollment in childcare. And one of the parts that sort of help to both support families' ability to go to work, but also to underpin the sector is childcare subsidy dollars. We have a state policy that's currently paying on real-time attendance or current enrollment rather than pre-pandemic enrollment. And that's a real challenge for programs as they remain partially full, right? And so you've got Angela's a perfect example of this. She's running a childcare facility, but she's not at 100% enrollment because she needs to remain a little bit less enrolled because she wants to make sure she's mitigating COVID and practicing all the really important health and safety things. Well, we need that funding to be maintained while we are through this pandemic until we really resume sort of back to normalcy. And then the third area is really around resources and tools. So one of the things that we launched early in the pandemic, I want to say this was about April or May, was the Find Childcare tool. So in Allegheny County, we were able to stand up with a group of developers, some national developers, a childcare finder tool that allowed childcare programs to state in real time whether they were open or closed. And this was really important as essential worker families were trying to find childcare, especially at the beginning when so many things were in flux. And so this childcare finder tool, and we'll make sure we put it in the chat, AlleghenyChildcare.org, has remained a really important tool, both for families to continue to find care, but also for programs to market themselves and let them know that they have spots available so that we can match needs to open programs. And then lastly, I'll just say that we spend a lot of time, we have this thing on Tuesdays where we provide roundtables for directors and owners to join 3 different calls throughout the day where they can work with their peers, talk with us, coaches and professional development instructors who can support them to sort of think through how best to do the good work that they do and how to respond to the challenges that they're faced with. We love those calls so much. And it's really where our providers, to Angela's point, they love the children in their care. They are a family's best sort of inoculation against the challenges of life. They know their children. They know many times by extension the families and the experiences that the families are faced with. And they're ready and able to support families, but they themselves need the support so that they can sort of manage all that's happening at the same time. So that's what we do on Tuesdays. So those are some of the ways that we've been supporting the field as well since March.
Thank you, ladies. I want to kind of shift into another area. And I think when we look nationally, um, there has been, we look at all the statistics nationally, there's been a disproportionate effect on Black and Brown communities. Are we seeing the same impact here? And I'd like to throw this out to all of you. And Diane, I'm going to swing back and start with you again. Are we seeing the same impact on Black and Brown communities here? And what does that look like?
Mhm. Yeah, I don't think the statistics are particularly different here. You know, we have health disparity, i.e. People who are lower income, people of color, sometimes it's rural versus urban, where there's rural poverty. We're seeing a disproportionate impact. And when you think about why would that be the case, part of it is that people who are essential workers are often people who are in lower paid positions. They are on front line. They're trying to, you know, go out and drive the bus, or they're trying to be in an infrastructure to support service delivery. So we saw a disproportionate amount. We also know that there have been a number of problems historically with access to care. So people with underlying conditions who've had less access historically, and in Pittsburgh, we are not unique in many ways. I mean, we have many of the same access problems to care that we do nationwide. And so one of the things that we felt was, you know, kind of if there's any silver lining in this pandemic, what we saw was a dramatic increase in the number of people who were accessing care through a telemethod, either a telephone or a mobile phone or a computer device. It went up like 50-fold. And one of the things that can do, I think, is begin to help close the gap. Now we have to look more broadly because there still is a digital divide. There still is a problem where there's broadband and other kind of access problems. But when we see the amount of, I'll speak to the mental health issues, the anxiety, the depression, the social isolation that's been happening for a lot of people, I think that one of the things, it's not a surprise when you look at the statistics that alcohol use is up, the marijuana use is up. We're seeing an increase in people self-reporting on suicidal ideation. We're seeing an increase in lots of stress. And unfortunately, in our Life Solutions program, which works with primarily commercial businesses, we're seeing a 250-fold increase in people calling about domestic violence. And part of it is not just partner-to-partner violence, but it's involving children. And so part of what I think we have to pay attention to is all the sequelae of this pandemic. And how do we try to support people during this time where they are feeling like their normal resources are not available to them. So children, as we all know, get a lot of their food at school if they're poor. When school is out in the summer, kids are hungrier than in the winter. And during the pandemic, they're hungrier. And so how do we find ways to reduce stress? Because we know the kind of maladaptive behaviors of stress are often those that turn to become somewhat self-injurious or injurious to others. So we've been doing a lot of outreach to really address and looking at this, and trying to look at where the families where income is more impacted, or their social network is more impacted, or they're forced to go into a job environment where they're not feeling safe. Those things make people very unsettled. And I think we have, you know, outreach opportunity, which is why I think it's been very good. The United Way has put a lot of infrastructure in place over the last pandemic months. And I think it's been helping a lot in our community.
I don't know that our participants can always see everyone nodding. Kara, I'm going to go to you. I see you unmuted yourself, so it looks like you want to jump right in there.
Yeah, I was just thinking about a survey. There was a national survey put out to the childcare sector. It was in late June by the National Association for the Education of Young Children, and asking about sort of the impact of the pandemic on their businesses. And similarly to Diane's statement, about 40% of those respondents said if they didn't continue to get assistance or relief during this time, they would close. But the number was higher for minority-owned centers. And that was really at about 50% of businesses of minority-owned businesses would close if they didn't continue to get assistance. And then we knew even before the pandemic that Black-owned childcare providers already were suffering from a racial pay gap. So prior to the pandemic, on average, a Black woman providing care was earning about 84 cents to every white woman's dollar. That's an existing problem that was only exacerbated, as the pandemic came. And then we know that in many minority-owned or minority neighborhoods where you have minority-owned childcare businesses, the families, the community, and the businesses themselves were disproportionately impacted by COVID. And so you had fewer families needing care because they were in industries that were most affected by the pandemic. So it's really been, I feel like it's really been layered on in terms of the impact of COVID for our Black and brown colleagues and women that run childcare businesses.
And then I'll come in. So short answer, is it disproportionate? Yes. So now, bringing that out a little bit, being able to say, let's bear in mind, it's not just COVID that's happening. We've also had an awakening for some around issues of racial injustices. And so you also have now our children who are coming in, who are watching the news and seeing various things unfold before them. And these are Black and brown children who are experiencing real life situations and then seeing that in their families as well. So I just want to make sure that we understand that everything doesn't go away just because you come into a childcare center and that these issues and situations are siloed. The other thing that I think is important for us to note on this webinar is that when we're talking about aspects of child care, children get older. And so we are a Star 4 facility, and I'm really proud of the team for maintaining that status. We believe in quality childcare, but we also believe in preparing our children to be able to go to school, able to read. And so when you look at that further on down the road, that we see the racial disparities in terms of educational outcomes and proficiency that we're trying to address at a younger age. So now disrupt that system. You've also then disrupted those achievements that are further on down the road, and how are we preparing children? And the last thing that I'll mention briefly is that we're also looking at YWCA, we're bringing a racial justice lens to all of our work. And I'm really proud of our team that as they were witnessing what children were coming in and like cues that they were getting, like you can get cues from 3-year-olds, cues that they were getting from them. They did these really wonderful racial justice rocks. So the children went out, they got rocks and they painted the rocks so that we can actually start to affirm that sense of self for our children that are coming in. So thank you, Kara, for all of the stats that you mentioned, but bearing in mind, life is still going on. You can have a study that says you should pay 7% of your income on childcare. That's not the reality for many of our families. We're talking 30, 35%. You have studies that say you should pay only 30% of your income on your housing costs. That's not happening. It's around 50%. So start doing the math. There's no money left over, right? So you still have to eat. You still have to feed your children. And so all of those situations are disproportionately impacting Black and brown families, which means that they're impacting childcare workers, and they're also impacting the children who are coming into our centers. So we need to be able to do something on a larger legislative scale to address the gender inequities and to advance racial justice.
Okay. Angela, I'm going to tell you right now, just keep your microphone open, because we're now going to kind of shift this conversation. I want to direct specifically to you and Diane this next question. And I want to kind of shift to gender related issues. And when we look historically, Women, for the most part, our earning power isn't as great as many of our male counterparts. Now we factor in this pandemic. We may have been at home for some time, and now, hopefully, as things get back to whatever normal looks like, we're coming back into the workforce. We're coming back into the workforce full time, kind of like coming back from the baby track or having kids. Now we're behind. Will we ever be able to? I mean, what is the long-term impact of this pandemic on our earning power going forward?
That's an excellent framing. And so again, women were already behind. And then you look at the studies, Black and brown women were even further behind. I mean, it takes us much longer to actually earn the income that we should. All of that said, can we recover with deliberate action? Yes, we can, but it takes making a change, right? And so why do we spend time as YWCA on advocacy? Because systems need to change, and we need to be able to put those in place. What I think is really interesting as you look at this crisis, and Diane sees it way more than I do because she has many more employees under her, is that we actually have seen women who have left the workforce. It's not a study for us. We have employees who have left the workforce because of issues of childcare. And when we look at it from families that we're serving, we're also at YWCA bearing in mind industries where there are not only do you have more women who have left, but they're going to take a longer time to recover. And when we're talking about leaving the workforce, this isn't, I have someone else at home. I just don't feel like working anymore, taking care of my children. Like, these are decisions that women are being forced into that actually want to rejoin the workforce. So we will be announcing some initiatives that we will be doing as YWCA moving forward to help women recover and partner with other entities. And recognizing that coming into this, small businesses have really been impacted in a very, very negative way. But all of that said, we still need to fight the fight in terms of gender equity and pay and advancement, equal pay for equal work, all of those factors that we were fighting before COVID came on our shores.
Want me to jump in here?
I do.
So absolutely agree. I think one of the key points, Angela, that you made is that alignment of issues related to COVID and social justice and racial inequality and all the things that have been really stirring in this country. And I think one of the things that we've certainly been looking at is that lens of, because I'm in the healthcare side of this, looking at that lens of racism, health disparity. How do we really look at how we look at gender? How do we look at race? How do we look at ethnicity? All the different kinds of things that can cause people to not get the kind of services in an equitable fashion. In terms of women, the question, I go back to, spent a lot of my career talking to women and being interested in women. And I always feel like if you want to help a child, help their mother. One of the things that we know is that there's been a motherhood penalty in our workforce. I think it was the Heinz Endowment study that said if you leave the workforce for 1 year as a woman, compared to somebody who works consistently for 15 years, you're going to have about a 39% income gap in your lifetime earnings. It's really hard for people to kind of come in and out of the workforce. We don't make it easy for people. So one of the things that we know is that as women look at, the study that was done years ago, women don't ask, do they start off at the same pay level? No. They still have some trouble asking for that initial, even when they're more qualified. So one of the things that we have to do is we have to look at what are the cultural influences that keep reinforcing that. We also have to look at the fact that even though the vast majority of women have been in the workforce, there hasn't been structures in the home that particularly offset the work in the home. So people work full-time in a home and they work full-time in a job, right? I mean, you know, there's if you have a 2-parent family, there are 3 full-time jobs, parenting and doing the home and then your work, right? So, and if you're a single mom, you've got 2 full-time jobs already before the pandemic. And then you add the pandemic that takes away maybe your mom who used to babysit for you because she's older and she has to, you know, be isolated because of COVID, her high risk. Or you take away your sister who used to be able to drive your kids to something that you, when you couldn't do it, or somebody else who can fill in those gaps, because schools and childcare are, you know, part of life, but they aren't the majority of the time we're in our day. So how do we begin to put all these pieces together? One of the things that we were able to do, and we have about 6,000 employees who work just on the insurance side of UPMC, but about 90,000 overall. And we were able to be pretty flexible with the workforce that did not have to be on site. So for example, if you pay claims for the insurance division, if you prefer to pay them at midnight instead of paying them at 8 a.m., we had that flexibility to be able to build in. We didn't take people's PTO away from them. We said, you can't use it now, we're gonna let it roll over and stay with you. We were able to, for certain kinds of jobs, be much more flexible. We found out that you could actually do a lot of stuff from home if you have the right infrastructure and support. And so I'm hoping that one of the things that happens after this pandemic is we'll learn a little bit more. We'll have seen where some of the big gaps are, but we'll also have said, you know what, we could be more flexible. We could think about job sharing more. We could think about virtual work more. We could think of off-hour strategies more. And we can think of ways where we can support people and really, I think, build networks for people to have more opportunity to connect around the problems and see if there are ways they can help each other.
Thank you.
And Lynn, before,
sure, go ahead.
I just want to say very quickly, because Diane also prompted something else in my mind. I know we have focused on women who are leaving the workforce or might have to leave the workforce, but for those women who are staying in and are working remotely, we've also seen many who have talked about issues of job performance. And so I'm straightforward. I have an 11-year-old at home, you already know that. And so she's a 6th grader. And it really is a challenge trying to monitor a child who's virtual learning and do your work. And so coming into like making sure that our companies, I think it's important for our companies or corporations to say, let's look at our HR policies, because now we can continue that inequity in terms of promotions and merit increases if we don't factor in the fact that women are also being caregivers. Women are much more likely to be caregivers, and when we are caregivers, we spend more time doing it than men. And so bearing in mind that linking those performance issues to your merit increases can then also have that gap even continue further.
I want to jump back in too to say, I think that's so important, because one of the things I think that's been something we've all had to learn more is how do you help a remote workforce? How do you help people stay engaged? How do you help them and support their productivity? They want to do a good job. They just have a lot of jobs. So one of the things that I'm really pleased about is we've lost some workers, but our turnover rate has actually gone down during the pandemic. And we haven't, we've been very, very fortunate to be able to keep people actively employed. But part of that, I think, has to do with if you can't be flexible, then they're going to leave you. And so I think that when you look at what's happening, we even look at our local region, right? I mean, we are going to be undersupplied as a workforce over time in Pittsburgh. I mean, that's one of our bigger problems, right? We can't afford to waste anybody, man, woman, black, white. I mean, we got to, everybody has to be able to partake and participate and be engaged. And so I think, you know, I'm hoping what comes out of the pandemic is a consciousness level that will get people more fired up to help do some of the things that needed to be done for a long time.
Thank you, ladies. Now, along those lines, and Kara, I'm going to come back to you because Angela and Diane talk about being caregivers, and we all know what that's like. I mean, we've all been in that role on some level. And one of the things that what I'm hearing from a lot of people is that a lot of childcare facilities have closed during the pandemic and may not reopen. They just may not. Um, some schools, the new normal, or when people talk about going back to normal, normal's not what it used to be. So what are we looking at, or what does childcare even possibly look like going down the road, 6 months, 9 months? I mean, we're seeing this vaccine roll out, but there have been some speed bumps. It's going to be slower than we anticipated. And not everyone's going to be comfortable either with the vaccine or going back into childcare. So what are some considerations that need to be factored in? Because whatever this normal is not going to be the normal that we know as normal.
Yeah, thanks, Lynn. I'm going to go back to something Angela said at the very beginning, and that is that childcare workers, childcare providers, childcare programs are essential workers. They are currently listed in the 1B priority group for the vaccine rollout. But as you said, the rollout seems to be a little bit slower, I think, than we've all anticipated. So, one of the things we're working on, and we're actually working with UPMC on this, is sort of a plan for rolling out that vaccine to childcare providers. So we're collecting the information that we need, doing pre-surveying, so that we stand ready as soon as vaccines are received to be able to provide that to childcare programs and their caregivers that work for them. So that's top of the list. I mean, I think that's an immediate need. Second, I think continuing to fund the infrastructure, to continue to fund the system so that it remains viable. And I'm especially worried about, and I go to Angela on this one, I'm especially worried about our high quality early learning centers. To Angela's point, her staff have worked really hard to become a STAR 4 or NACE accredited program. These programs are your they're your stars, they're your anchors in many communities that are challenged, that are under-resourced. They provide a million other wraparound services, whether it's food, as Angela illustrated, or connections to jobs or support for families. But not losing high quality childcare centers is fundamental to sort of getting through this pandemic. That is the last thing we want to lose. And so really sort of prioritizing and making sure that our high quality facilities survive is of top priority. So again, going back to, and I'm seeing some of this in the chat box, really advocating for childcare. We need parents, families, we need employers saying, hey, as an employer, I've got employees who are struggling with their childcare programs, struggling to maintain the work that they want to continue to do because childcare as a sector isn't being supported. So we need you to prioritize that at the state level, at the federal level, and here at the local level. So those are just a few things that I think have to continue to be of top priority as we move through this next year.
And then let me just kind of piggyback on that. And let me just remind our guests that you can certainly funnel your questions through the chat, and we'll try to get as many of your questions in as we can. So speaking, how do we get more childcare seats opened up and available? Because, as we work through this process, there will be more and more parents looking to get back to work full time. Are there plans in place, or are there ideas out here that could assist or make it support services to get more childcare opened up and available?
Yeah, I see Angela nodding too. So I bet she's got some thoughts on this. I want to go, the ability to have childcare spots begins with having the staff to be able to manage, care for, educate children. The number one challenge that existed before the pandemic, and that is probably what Angela thinks about every day, is how to retain and maintain her staff. They are teachers, they are caregivers, and they are the most important ingredient in a childcare facility that impacts a child's cognitive, physical, emotional, social development. They are the most important ingredient. If we can walk away from one thing and say that caregiver, that woman that hugs, loves on, wipes noses, sings, rhymes, diapers, if we can walk away and understand that they're the most important ingredient, then it will have been a win. Diane's point around help a child, help the mother, help the child, help the mother, help the caregiver that's helping the mother, right? So let's just go even one step forward. So if we can value the individuals that provide that caregiving, and when I say value, I mean, you know, the average wage for a childcare worker, this is where I get really heated, is $9.71 an hour. That is ridiculous. It is shameful. They are doing the most important job, not to take away from other service industries, but you can go in different places and get a starting wage, $11 and $12 an hour. And they're not doing as important work as caregiving of children. So if we can value the teacher, value the caregiver by making sure that their compensation is something that allows them to live a life, to have their own family, to not worry about whether they're going to have food on their plates, that would be a huge start. And I'm just going to add one more piece of data. 50% of childcare workers in the state of Pennsylvania are on one or more government benefits.
Wow.
Again, that is shameful. That is not an industry where we should be sort of seeing it as less than. It's an industry that is of top priority. It's, you know, what's at stake is our future, our child's future, our family's future, our community's future, and our economy. So yeah, I'll get off my soapbox.
All right, we'll let Angela respond and then we'll come over to Diane. Go ahead, Angela.
My first response is amen, right? So coming into this, that there is definitely a challenge for compensation. The other piece is that we need to support the infrastructure for childcare systems, and that has to happen at a statewide and at a federal level. So yes, we need to address compensation. One of the challenges that we've been facing, that we've been facing and have faced at YWCA is we want to maintain quality, remain affordable, and also maintain safety during this time. So now put in social distancing guidelines, and Kara alluded to this earlier, for my childcare center, but my ratios in terms of the number of workers that I need in that classroom and for each child, those don't change. And so now I cannot serve as many children. We were very fortunate to be able to use other spaces within our facility. But again, I can't just launch a new classroom with the same number of workers. And so it's just the math, it doesn't work out in the spacing. I have that ability, and we are very fortunate and blessed to have it. But now put that into a smaller facility that doesn't have 2 extra rooms to go to, that doesn't have workers that they could then repurpose and reallocate to different spaces. So that's one. The other situation that we've been facing, and Kara can see this at a broader view, is, as I mentioned earlier, I have also workers that may need to take leave at time. I need to replace them. And the subsystem that we typically go to, we've had challenges getting substitute workers. We've had challenges hiring, that there are many people during this time who actually have not wanted to go into that face-to-face type of interaction daily during a pandemic. I'm hoping on the other side of this that things will improve. But again, if we don't address some of the pay issues, that will also continue to be a challenge. So we are definitely working on it at YWCA from our own internal perspective, but then also going and partnering with others to see what can we do at a broader, but I cannot say it enough. We need for our legislators to value childcare as a system, to value the workers, to value our centers, and to support this industry. And I did see in the chat that someone else also mentioned nannies as well, that we also need to, look broader to those who are doing this on a more of an individual basis and may have lost work during this time, or also have maintained their work and are going into homes on a daily basis. So, amen, Kara.
Diane, I'm going to bring you into this. Did you want to piggyback on that first before I?
Well, the main thing I think in terms of what both Karen and Angela have said is really you're talking about a basic economic problem. You're talking about a lack of a living wage. And one of the things that we really have to address, I think, across various industries, but when you look at what's important in education and early childhood education and childcare, you have to really think about the value system of a nation that doesn't think people are worth paying or keeping some kind of career trajectory for them. So, you know, I'm really proud that UPMC, I think we were the first big healthcare system in the country to announce that we were going to a $15 minimum wage for any employee at a minimum. And that's been instituted here at UPMC. And I am proud of that. You know, it's still not enough money for people in general, but at least it's better than what's out there in a lot of places. And I think part of what we have to do as a society, and again, you get back to societies are made up of communities, and local community has to put pressure on state, and state has to put pressure on Fed. And I agree that I think part of what we really need is a much more systemic way to address this. Because if you look at who's in the lowest paid jobs in the country, they're women and people of color.
So Diane, this is another question from one of our audience members, and I'm going to direct this one at you just because it has kind of a global perspective, and UPMC has a global footprint. And the question is, how do we learn from other countries and their policies where women have more equity in the workforce and educational equity for children? I feel in this country, we kind of play around the margins for universal health care, child care, longer parental leave. Yet other countries seem to have better policies. Is that a fair question to bring to you?
Well, I'll give it a try. You know, I think if you look at it, and it depends on which countries we're talking about, obviously. But if you look at the countries that are the more economically advantaged countries, you do see more support in most of those countries for things we would call in this country the social safety net. You see more support for childcare, leave, maternity after giving birth, family support for you know, both parents to be engaged with the child after delivery. You see a more focused support on social network as a proportion of their total GDP than you see in this country as a proportion of GDP in this country. You have a dynamic in this country where, and I think education and healthcare have a lot of similarities in this way. We are the most expensive country per capita in the world in education, and we're the most expensive company per capita in the world in healthcare. And yet our metrics aren't as good as many countries, either in healthcare or educational attainment of our population. And so when you look at that problem, you say, why? And part of it, I think, has to do with how do we think as a nation? Is healthcare a right? In my opinion, healthcare is a right. Everybody should have the right to healthcare. I believe in universal coverage. I believe that it's not something that people should have to be debating about whether they can actually afford. And I think a good education is a right. But a good education starts early. You know, by the time a child, I mean, I'm not the expert in childcare or education here. You know, the other panelists are more qualified to speak to that. But I know that by the time a child is in preschool, they can already be behind if they don't have the right help. And by the time they're in kindergarten or third grade, their fate can be sealed if they don't have a reading capacity that other children are gaining. So we have a lot of work to do, but I think that we can learn some lessons from other places, but I think it comes down in part to our policy and where we put our money as a country.
I'm going to come back to Kara and Angela here because I feel like we've gotten a lot of questions about how we keep high quality childcare, keep the facility solvent which seem to address in many ways the concerns of working parents, working mothers specifically. So, is this a governmental issue? Is this a corporate America issue that needs to help subsidize those programs to support their employees? How do we fix that problem? Because it sounds like a lot of that is the crux of the problem.
Yeah, Lynn, oof, that's a big question. And, you know, I think in my ideal world, going back to what Diane said, it's a right. For me, education and health, first of all, are intertwined. They're not even separate issues. They rely on each other, right? So if we start with, you know, Diane's point around it being a right, and then say, how do you fund something that's a right? It probably starts in the public space. Um, However, if I look at sort of what's ahead of us in the very short term and then maybe in the more realistic term for right now, it probably is the solution lies in a public-private partnership. So it is both sort of government sort of stepping in, recognizing its value and priority. We have seen that off and on at the federal level in different presidencies speaking about sort of the importance of both healthcare, but also early childhood education. But I also think we need employers really sort of thinking creatively about how they can be a part of that solution. And it means everything from, and I heard it coming through Diane's conversation or Diane's talk, it's everything from childcare stipends to employer-based on-site childcare to sort of reshaping or rethinking flexible hours. You know, it is the range of ways that we can meet the needs of families. Not all families are the same, they're dynamic and everyone has different needs. I saw, I think Angela put something in the chat box around infant toddler care versus school-age children care. That's vastly different. When I think about infant toddler care, if we had, Diane pointing to other countries, if we had support so that new families with new babies could be home for the first year of a child's life, that would mitigate a lot of the challenges that we see happening with young children. Because it would provide an opportunity for baby and families to bond. It would take the stress out of sort of juggling sort of the changes that women experience after they've given birth, juggling with work. It would also, infant toddler care, Angela can talk about this, is the most expensive care in a child care facility because it requires the lowest infant to baby to adult ratio, right? So it's also the most expensive. So it would also solve a piece of sort of the childcare funding issue that is there. So I think, to your question, I think it's a public-private partnership, and I think there are a range of solutions and ideas that Diane's pointed out, Angela's pointed out, many others I think are suggesting in the chat box. But I think there are ways to begin to get at it. It's just about the will. And making sure that we keep it as a priority priority as we think through our policies going forward.
Yes, I agree. Public-private partnership. And I think it's also important for us to understand the role of the foundation community as well. And if you haven't looked at it yet, Pittsburgh Foundation has a really great study that they also did on women in poverty, where they put forth some policies. And I've already pointed to the YWCA USA recovery, America's recovery from the She session. It's a hard word to say. That said, it's also important that when these collaborations are happening and when we're talking about legislation and we're making systems change, that we involve our frontline workers in the process and also our families. And so being able to say the voices of those who are providing service and who are using the service should also be paramount in decisions about the system. That's critical. sitting as a childcare provider, I learned a lot about what things happen at a state level and what things happen at a federal level. Even as we were deciding as an organization, were we going to shut down? And as we were deciding, what's going to happen with our childcare facility, the governor made the decision that childcare centers were closed. When we wanted to fight in terms of making sure that there were funds in a system to support childcare, we were then saying, okay, let's take that to a national level. So even looking at those challenges and what that means across the spectrum is important for us. So yes, there are solutions. I don't want to enumerate them. Again, they're done really well in the SHE session report, enumerated not only in terms of workers, but also the overall infrastructure of the system as well. I encourage everyone to take a look at it. And to echo Kara's point in terms of infant toddler, yes, it is extremely expensive, and the number of workers that you need. And then again, putting that in a social distancing, that means that unfortunately I have to turn away families with infants. And it's a hard thing to do. It's very hard.
Diane, I think this question is going to be for you. One of the challenges in being a working mother in the workforce is the perception that I can't go for promotions because of the responsibilities I have at home. What advice do you have for high achievers who are also committed to caregiving?
So, as a mother of three, and somebody who remembers when my children were young, that I always felt like I was in the wrong place. When I was home, I wasn't getting my work done. And when I was at work, I wasn't taking care of my children. And I just remember those days that felt tough. I think that what I would say is that, I mean, honestly, if you're in an environment where somebody thinks you can't do a job because you have children, then I would say go to a new environment. I mean, you can't, I mean, it's a little glib, sorry. But, there is obviously still tremendous institutional sexism. And we know that disproportionately childcare does fall to women. I would like to believe that the world is changing, but I think that we have to raise our voices to make it change. And part of the issue is obviously people, should be able to go after promotions or do the kinds of things that they think are appropriate. And basically, I would say at a very practical level, I would find mentors in your organization. I would find people who you can network with. I would bring the question to people I could trust to get their feedback. I would try to understand how much of my perception is being driven by my own worries, how much is the culture of the organization a problem, and where do I see my opportunity to have a good shot. And I would obviously, if you're in an environment that you're feeling like you're not being able to be promoted or do your best, then you really have to reevaluate that environment. I don't know. I'd love to hear other people's comments on that because I think that is a really hard question.
Well, we did have a few head nods over there. I'm just saying. I don't know if they want to jump in, but there were definitely head nods over there. Yes, no? Or did the nod say it all? Angela?
Well, and there's that part of me that just can't get rid of the question of, are they making the same assumption about your male counterparts that have children? And so that's also something to think of. Again, it's this issue of gender equity. And I get that we spend more time as women in our caregiving responsibilities, but it does not make us any less able to do the job and to advance. And and that's why I'm saying, echoing the mentors, it's so important to have that mentor, have that person who is that pusher for you to say, I am a viable candidate for this promotion, and here are the supports that I will need in order to do the job, and find a nicer diplomatic way of saying it. And when I do it, I'm going to rock at it, right? I'm going to be the best employee that you have in that position.
And I also think it's a challenge. I mean, I would say that the for leaders of organizations, I think it's why it's so critically important that we tackle gender discrimination in our business communities, in our associations, in all of the different ways that women can and should be visible, because people need to see people like them in positions of influence, and it is really important. And Pittsburgh is not exactly, set in, they're not way out front on these issues regarding women or people of color, or it hasn't been the best city in the country for these issues. And I think we made progress, but I think we have a way to go.
Well, you also, we can talk about gender, but let's be realistic. If men were the caregivers of our children or parents or whomever, I don't know that we'd be having any of these conversations, would we? Just asking. I think there would be a place, there would be support available. One of the questions from our audience: is there a way for us as individuals to support policy by sharing our voices with our legislation? So where would you direct those folks who want to speak up and speak out?
I'm going to jump on this one, Lynn. So if everyone, one of the things you can do real simply is go to our website, tryingtogether.org, go under the advocacy tab, and there is a take action button. This allows you to get involved in a number of statewide campaigns that are doing the advocacy to get greater federal investment, greater state investment. And then locally here, there are a lot of folks that are working to make sure that the new Department of Children's Initiatives gets established at the county level, again, to support early learning, after school for children. So I would start by visiting our website. You can go directly to startstrongpa.org, which is the childcare campaign for the state of Pennsylvania that is working to get increased investments, both in access for families to have access to high quality programs like Angela's, but also to make sure that the quality supports are there to provide all of the things that childcare providers themselves need. And so that's a great way to sort of get more involved. We have a whole policy shop that is always working to make sure that family voice, provider voice is the first voice that is heard with our policymakers and decision makers. It is as simple as sending an email to your local representative to say, this is a priority for me and my family. I can't tell you enough how that is the thing that changes policymakers' minds. If their constituents say what is important to them and are consistent in saying that, they will respond because they need your vote. So again, folks, you can go directly to our website, to startstrongpa.org, or just look up your legislator. I can put the link in the chat box. You put in your address, it tells you exactly who your legislator is, and send them off an email. But there's lots of ways, very simple digital ways to, we've been doing a lot of Zoom meetings with legislators, to center visits. Angela's center has hosted a number of legislators over the years to sort of better understand what high quality care looks like and why it's so important. So there's lots of ways of getting involved. I'll even give you my cell phone and you can call me afterward and I can help get you connected.
I have another question from the audience, and that is, as we've seen throughout this pandemic, the needs are there. There are also needs for things like emergency childcare. Are there, and maybe this is a question for you, Kara, are there new models for emergency childcare? They use the example of Jeremiah's Place that should be replicated as place-based strategies in high-need communities.
Yeah. Angela, do you want to answer this?
I was going to say, maybe you could explain for those of us who aren't familiar with Jeremiah's Place as well.
Yeah, I'll leave that one for you, Kara. I will say that we explored our ability as YWCA to offer that type of service, and we weren't able to at the time. But definitely Jeremiah's Place is an excellent model, but I'll leave that to Kara to explain.
Yeah, so Jeremiah's Place provides 24-hour what is called crisis care. So it's meant to support something happens with mom or dad, and on very short notice, they need childcare. that is a place that a parent, it's very high quality. It's a place a parent can leave their child for a short period of time so that they can go handle whatever the issue or crisis is at hand. What we have seen, and this is sort of the interesting part, is what we have seen is that it's not really for families that, well, let me just say this, as a parent, all families struggle. I have my ups, my downs throughout the year. But even if I think about sort of my parenting over the past 16 years, there's been phases of parenting that have been more challenged, whether it's been what's sort of going on in my extended family or work than others. So all families need support. But what I think is interesting about Jeremiah's Place is they have seen over time that a lot of the sort of short-term care that is needed isn't necessarily related to a big crisis in a family, but it is things like, I lost my job and now I need to interview, but I need somewhere short-term to be able to leave my child so I can go do my interview, right? And it is little life's moments. My car broke down and now I've got to go handle getting my car to the garage and managing all of that. And I can't do that with 2 young children in tow. It is sort of how you manage your, sort of the reality of managing your life. So Jeremiah's Place is a huge asset to the community. There's only one of them. And what we know is we have a lot of families who also have second and third shift employment experiences. And so if an employer doesn't provide them with enough notice of the change in their schedule, then they need that short-term childcare fix. They will utilize Jeremiah's Place. But we don't have, Angela said they explored sort of being either a crisis nursery or a 24-hour or even an extended hour childcare facility. We don't have enough childcare facilities in the county that provide what are considered non-traditional hours. So hours outside of 7 a.m. to 6 p.m. And yet we know there are a lot of employment experiences that are in those non-traditional hours, that second and third shift. We know there is a need. Unfortunately, there isn't a funding mechanism for supporting that. There isn't sort of incentive pay or the state doesn't reimburse at a higher wage for providers to provide care overnight time, right? But it's also a really hard thing to staff. So there's got to be some sort of incentive. So that is both Jeremiah's Place and replicating that is important, but also even extending that to think about how do we provide more childcare providers that can provide non-traditional hours. That's an important need here in the county that has yet to be sort of figured out.
Wow, what a fantastic panel and what a robust conversation. It's really difficult for me to think about how I can wrap this up and close it. One really great point of hope in knowing that we have such strong leadership here in the Pittsburgh region addressing these issues. Has the pandemic created a childcare crisis? I think what we heard this morning is no, didn't create it. It frankly was already here with a lot of the other issues that we're facing throughout the pandemic. How much is it to blame for women exiting the workforce, the labor force? It certainly is a contributing factor. And what can be done to create reliable, safe, caring solutions for our children? We heard a lot about flexibility and raised consciousness and really wanting to make sure that our childcare workers are valued and don't have to call 211 for services themselves. So I think we heard a lot of good ideas about how we can move forward. We have to work together to strengthen family leave. We need to create strong and reliable childcare systems, offer programs that help women re-enter the workforce, and reverse the trends that we're seeing right now. So I'd just like to summarize a little bit about some of the things that we can all do together to address this. First, we need to support and invest in programs that keep women workers in the workforce, help them re-enter the workforce after the pandemic. Some examples that we heard today include remote work, flexible hours, perhaps structured internships, returning to work, hiring days, workshops to help support women, and talking to employers and encouraging management to do these things if you're not in the position of implementing them yourself in your workplace. We talked a lot about advocacy. You could see Kara coming up out of her chair as she was giving some of the answers, such a passionate advocate for childcare. We all have a voice and the means to be able to be heard at the local, state, and federal level. We have to make our representatives aware that childcare is critical to rebuilding our economic infrastructure. It's as essential as our roads and bridges. We heard several of our panelists refer to that. And following this session, we will share specific ways for you to get involved and in advocating for government support of our childcare systems. For our part here at United Way, we will continue to work with our community leaders to help solve the childcare crisis. We are members of a coalition that helps ensure that our childcare providers are funded and are viewed as the essential services they are. In addition, and you heard a little bit about this in the program, we are proud to partner with Allies for Children and the Poise Foundation, as well as the Fourth Economy, to issue a monthly Community Pulse report. You can find current and past reports on our website, uwswpa.org. This will include a lot of critical information about what's happening during the pandemic in our community. Again, I want to thank Lynn Hayes Freeland for today's moderation of the expert panel, and the panel members themselves for sharing their expertise, their perspectives, and insights. And I want to thank our audience for your time and for your thoughtful questions. Our chat box has been very, very busy throughout this program today. I think many of us are happy to say that 2020 is over. But no matter how much lamenting we've all expressed about what a terrible year it was, we have to be honest with ourselves. The problems that we have, and this one that we've been talking about this morning, the human struggles that so many of our neighbors are facing weren't invented, didn't pop up only in the last 12 months, but they have certainly become more widespread and more urgent than ever before. So the question is, how will we as a community and as individuals work together to answer them going forward? It is within our control. And as long as people like you make change a priority going forward. And that, my friends, is the inaugural, The Question Before Us. Thank you for joining us and have a great day.
Thank you, Bobby. Thanks, Lynn and Diane and Angela. It was great having this conversation with you.
It was a good conversation.
Agreed.
Yeah, it was a really
Thank
good
you.
conversation.
It was terrific.
Yeah, I think a lot of people got, I think people got a lot out of it as well.
Yeah.
It's good stuff. Yeah.
You can
Well,
always see when folks are active in the chat that they have a lot of insight and passion around the issues. And we certainly saw that today.
Yeah, exactly. Yeah.
Yeah, and attendees
Again, like I said, it affects
stayed
all of us.
They did. Yeah.
Yeah.
Yeah, they did.
Thank you for inviting.
yeah.
Yep.
It was a
All
real
right.
pleasure. Thank you. I learned
All
a
right.
lot.
I learned a lot.
I
from
think,
you,
I
Diane.
think we all did.
I
Yeah.
I know. I was like, Diane, I learned so much.
There's a lot going on, but thank you. Thank you so much for inviting me and great to see you guys today.
Y'all brought
Absolutely.
great
All right.
perspectives. So thank you so much and have a good day.
All right. You too.
All right.
Take care.
Bye, everyone.
Bye.